I'm Dr. Richard Lyon, and in this video I'm going to demonstrate how to use the Prometheus PIN. The PIN provides rapid intraosseous access when gaining intravenous access is challenging or impossible. The Prometheus PIN can be used in emergency medical or trauma cases and can remain in situ for up to 24 hours. In this video, we're going to insert the Prometheus PIN into the humeral head, but the device can also be inserted into proximal or distal sites on the tibia. Clean the insertion site with antimicrobial solution, and if the patient is awake or alert, administer local anesthesia as required. Hold the pin in the palm of your hand and place your thumb and index fingers in the cannula hub finger slots. Puncture the skin at the insertion site and push the needle through the subcutaneous tissue until contact is made with the bone. Make sure that at least one graduation on the cannula is visible above the skin to confirm adequate needle length. Begin bone insertion with the needle at a 90-degree angle to the surface of the bone. Steadily twist the device with gentle inward pressure, making sure that the needle does not bend or sway. Keep twisting through the bone cortex until a slight give is felt, which signifies breakthrough into the intramedullary cavity. When this loss of resistance occurs, remove the needle stylet by stabilizing the cannula hub and withdrawing the needle. Prime the provided connection extension set with normal saline. Then connect to the Luer-Lock connection at the cannula hub. Confirm intramedullary needle tip position by aspirating a small visual quantity of bone marrow, then flush the needle with saline. Without a positive flush, flow may be suboptimal. Once the system has been flushed, you can administer medication and fluid as indicated. Always consult the full instructions for use for warnings and precautions before using this device.